Well, hello, it's Bruce Williams, and today I want to present part 7 of my series on the gross pathology of the dog. We're going to talk about the musculoskeletal system. But before we jump into it, I want to thank all my friends and colleagues who over the years have provided me these fantastic images, either directly or through online collections, which allowed me to put this series on the pathology of the dog together. Let's start with a very common finding. Brachygnathia can occur of the mandible most often, occasionally of the maxilla in the dog, and is commonly encountered in otherwise normal dogs, or it may be associated with other skeletal defects. This is an absolutely great lesion that's seen primarily in black and tan breeds of dogs, such as German Shepherds and Rottweilers. And the disease is called chronic masticatory myositis. It's also called atrophy of the muscles of mastication. And those are the muscles that we use to chew. You can see in this animal there is extreme atrophy of the masseter and the temporal muscles, because these muscles have a special type of myosin, type 2M myosin, and it's thought to hold certain antigens in common with certain strains of bacteria. So if the animal is exposed to the bacteria, over time, the body will become sensitized to those antigens and then begin to attack these muscles as well. There's often a local inflammation with a predominance of lymphocytes and plasma cells, or less commonly, eosinophils. But it takes a while for this disease to progress, and blood work usually shows no abnormalities. There's a normal creatine kinase and aspartate aminotransferase. Biopsies early in the process may show a lot of inflammation, but as we get closer to this particular stage, you may see very little inflammation. It's a pretty classic disease. The only potential rule out, I suppose, might be polymyositis, which is an immune-mediated disease attacking the skeletal muscle of various parts of the body, and occasionally you'll see one that will attack these muscles as well. That's more a biopsy thing, because if you see one of these animals in the flesh, they have a lot of trouble opening and closing their mouths, especially early on because of the pain. So if you see one of these in the flesh, you're probably not going to mistake it for anything else. This is a great lesion that we see in young animals, especially bulldogs and French bulldogs, and it results in kyphosis, often of the skeletal or the spinal column, and this is a Hemi vertebra. You can see it's about half of the other vertebra. It's a little deformed, and there's always some deviation of a spinal column at this particular point. It's a bulldog thing. If we're talking about orthopedic disease of young dogs, we need to talk about trauma for just a minute. And animals with open growth plates will undergo a special type of fracture known as a Salter fracture. And there's about 5 different kinds in veterinary medicine, 2 of which can be fixed without any deviation of the bone later in life. These deviations or angular deformities result from injuries that do damage to resting chondrocytes or damage the blood flow to the growth plate, which comes from the epiphyseal artery. We're looking at probably a type 1 Salter fracture, which goes through the growth plate. Believe it or not, this one, which just cracks right through the growth plate, if everything's put back together correctly, will result in no angular deviations. A second Salter fracture will include a fracture of the metaphysis. Remember that the blood supply comes in from the epiphyseal artery, so if you damage the metaphysis, usually there's going to be no angular deformity. Now from here on out, you end up with angular deformities. The third is a fracture of the epiphysis, which incorporates the growth plate, and because we are damaging the blood supply to the developing and maturing growth plate, you're going to have angular deformity. Salter 4s include all of it. Includes the growth plate, the metaphysis, and the epiphysis. Once again, damage the epiphyseal blood flow, you get angular deformities later on in life. And finally, number 5 is a crushing fracture, which actually crushes the growth plate and those resting chondrocytes and the blood supply. So type 1 and 2 heal with minimal problems. Type 3 and above, we're going to have some issues here. Salter fractures. I believe there's a type 6 in people, but I've never really paid much attention to that. Hey, we're still looking at diseases of young animals. And if you look at this particular set of bones, you can see that there is a very pale part of the bone underneath the growth plate. This is known as lines of metaphyseal osteosclerosis. Endochondral ossification and the lengthening of the bone requires a number of components. Everything from appropriate mineralization of the primary trabeculae, appropriate formation of the primary trabeculae with collagen, that type 1 collagen that is correct. Something else that is absolutely mandatory for remodeling this primary trabeculae and elongation of the bone is the presence of viable osteoclasts. During viral infections in the dog, the cat, and other species, viruses may infect these osteoclasts, killing them off, and there is nothing to resorb or remodel. The bone continues to grow, the primary trabeculae continue to elongate, but they're not remodeled. The virus that causes this in the dog is canine distemper virus, but you can occasionally see this with lead toxicity, so-called lead lines, because lead is also toxic to osteoclasts. You can see it with feline herpes virus type 1 in the cat. You can see it in a bovine pestivirus in calves. It's generally a temporary situation, and then when the viral infection is taken care of, the osteoclasts are repopulated, and this area of osteosclerosis will continue to pass further down into the diaphysis as the bone continues to elongate at its end. This image, which has been used for many years in many textbooks, was actually taken by Tom Monticello, and it's such a great picture, and he deserves great credit for this. So, viral infection impairs osteoclastic activity on the primary trabeculae, resulting in lines of metaphyseal osteosclerosis. Usually with the viral infections, you don't see the osteoclasts here. With lead, you will see along these lines, you will see plenty of osteoclasts, but they seem to be separated from the surface of the trabeculae and can't seem to degrade the mineralized matrix. Now this is a little different from what we see here. These are called growth arrest lines, and these are seen as a result of periods of malnutrition when the animal simply is not getting enough calories and energy. During this time, when a lot of non-essential processes shut down in the body, what the bone will do is it will put down bone instead of perpendicular to the growth plate in a parallel fashion. It's very similar to what the bone will do when the animal has stopped growing and it caps the physis. But for some reason, the bone is put down along the epiphysis, and you get these horizontal lines of bone. When the animal gets back into a good plane of nutrition, the bone will continue to grow, and these horizontal growth arrest lines will move further down into the diaphysis. Notice between these two growth arrest lines, okay, there's very little bone in there. It just wasn't being produced. So you have these big gaps. These are areas that represent osteoporosis. You know, you can even see growth arrest lines in fetuses as a result of defective maternal nutrition. So growth arrest lines resulting from a condition known as agrosariosis, or simple malnutrition. Don't confuse those with the metaphyseal osteosclerosis, which you actually get a more dense area of the bone. We're still talking about bone diseases in young animals. This is a classic disease of usually of large breed dogs who have recently undergone some type of infectious or inflammatory disease, and then they come up very lame. Sometimes they will have sort of a flaring or mushroom shape at the distal epiphysis of the long bones of the legs. I learned this as hypertrophic osteodystrophy, which is a terrible name, and so it has been replaced with a name I think that is just as terrible, and this is metaphyseal osteopathy. If you know me, I hate opathy words because it means we don't really know what's going on, and I think we have a good handle on this particular condition. Metaphyseal is pretty good because it happens in the metaphysis. Okay, it is not a disease of the growth plate. The growth plate is intact. And what you will see in this particular condition, which primarily affects the ulna and radius, but any fast-growing bone can be affected, including the ribs or the vertebra. But we usually see it down here at the ends of the radius and the ulna, is that if you take a look here, this area of loss of bone. I'm going to give you a great word here. This is an infraction. An infraction is like a fracture, but there's no lateral displacement of the bone. So we call this when the bone is resorbed. And it's essentially gone. We call this an infraction. And what we'll see if you take a section through this is lots and lots of neutrophils. Okay? So it is essentially a suppurative metaphysitis. So it's usually seen in young animals between 3 to 6 months of age. Weimaraners seem to be overrepresented, but a lot of different large breed dogs will get it. And usually they've had some sort of inflammatory infectious disease. They might have had diarrhea the week before, and oftentimes it may be associated with like a parvoviral infection or something, but not all of the time. And what happens is that you, once again, you kill off the osteoblasts and no bones put down on the primary spongiosa, and you get this necrosis and suppurative or fibrinosuppurative osteomyelitis. As we said before, it's been linked to outbreaks of parvo. It's also has been identified in litters of collies and other breeds of dogs with leukocyte adhesion deficiencies or neutropenia. The exact pathogenesis hasn't totally been worked out, but it's a lot better than back in the day. They used to think that this was due to a lack of vitamin C when I was going through school. So that shows you how far back that is. So a lot of these animals are put down because of the intense pain. Look at this leg, and can you imagine having lesions like that in both front forelimbs or maybe multiple bones in the body? So it's an incredibly painful. The body tries to stabilize this bone, this infraction, by putting down extra bone here at the metaphysis, giving you a nice flaring of the metaphysis. So this is metaphyseal osteopathy, another disease of young dogs. Okay, one more disease of young dogs, a interesting disease that's most common in German Shepherds, which is known as a ununited anconeal process. And you see these two fractures here. Now, the anconeal process has its own ossification center, which develops at 11 to 13 weeks and expands for about 6 weeks, and then it unites with the ulna, usually somewhere around 4 to 5 months, and solidifies into a portion. Now, there's a specific defect in some animals of the cartilage of the ossification center, known as epiphysiolysis, and you get a fissure formation through the physis here. There's no dysplastic change. It just goes straight through the cartilage there, and these will break off. Now, also, there's another little ossification center here which forms the coronoid process, which can undergo the same thing. Usually you just see the anconeal process. If you see the two together, it's called elbow dysplasia syndrome. And epiphysiolysis is a very interesting event because there can be absolutely no abnormalities in that cartilage, and then it just sort of, because of weight and shear stress, it sort of pops off. We also see a similar change in cats in the femoral epiphysis of heavy, young, castrated male cats, where the head of the femur, the ball joint of the acetabulum, just pops off right through the cartilage, which was the ossification center there. And you also see it in pigs, in sows, at the ischial tuberosity, because some very big muscles, their ligaments anchor there, or the tendons, and it just pops those ischial tuberosities off. So that's epiphysiolysis, no bone change. It's a defect that breaks right through the cartilage. Here's a great disease that you will see in the dog, which has also undergone a name change, and the names to me are always somewhat confusing. This one used to be Hypertrophic Pulmonary Osteopathy, and now it just goes by the name Hypertrophic Osteopathy. And in hypertrophic osteopathy, you see periosteal new bone growth that primarily is in the legs. Here, the radius and ulna and distal humerus, and you can also see it on the metacarpals, and same thing in the back legs. Generally, not so much at the articulating joint with the thorax. And this particular condition is usually associated with some form of disseminated inflammatory or neoplastic disease, primarily of the thorax. That's why it got the name hypertrophic pulmonary osteopathy. But it can also be seen as a result of lesions in the abdomen now as well. So they dropped the pulmonary. And initially, the way I learned it, it was just tumors in the lung, but they can certainly cause this. Now it's been associated with a lot of other diffuse changes, including fungal infections of the lung or heartworm disease, and tumors in the abdomen have been identified as causing this particular lesion. Now, the cause of this is still sort of in question. One theory is that these pulmonary diseases lead to irritation of the vagus nerve and increased blood flow to the extremities. And before this bone is laid down, a proliferation of very vascular tissue is usually the first histologic sign. At the level of the periosteum, there is increased arterial pressure, hyperemia, edema, proliferation of vascular tissue, which ultimately becomes periosteal new bone growth. There's no change in the endosteum. This has been created experimentally by creating shunts which bypass the pulmonary circulation, increasing the stroke volume of the left heart and forcing additional blood into the peripheral circulation. This is a so-called well, there is one more theory which is suggests that there is a substance secreted initially by the tumor now that is normally broken down to the lung but doesn't get broken down, and that's why these shunts cause this disease. The true cause probably not known, but it can also be seen in horses with ovarian tumors, and the disease is also seen in people, but it's a bit of a different disease. So this is hypertrophic osteopathy. Look for periosteal new bone growth in the middle and distal part of the legs. And here's a great picture that shows just how much bone can be laid down if this is the pre-existing cortex. And this is a section which shows how much periosteal new bone growth can be. And the other thing, besides the astonishing amount of bone that can be laid down in these animals, is the rapidity, because the width of the cortex may be doubled in only a few weeks. Here's something that's a little more breed specific, and it differs from some of these diseases that we've seen before because in addition to having periosteal new bone growth, you get endosteal new bone growth. And this is a condition which is known as craniomandibular osteopathy. And you certainly can see the new bone growth on the outer part of the mandible. There's also a little bit here on the ramus of the mandible. You can see some on the occiput. And these animals often will have some extra bone put down on the tympanic bulla. So you get very thickened cortices and endosteum with disorganized woven bone being laid down on both sides. And when you cut through here, it just looks absolutely crazy because as compared to periosteal new bone growth, endosteal new bone is just laid down in all sorts of willy-nilly. Very interesting biopsies from this. At the height of disease, you'll also see mineralization of soft tissues of the jaws. And these animals can't even, the really affected ones can't even open their mouth. There's a tremendous amount of pain. Now, these occasionally will regress as well. Not a whole lot of... I forgot to mention, these are often associated with certain breeds, including terriers, especially Scottish terriers, Westies, and Great Danes as well. Not a lot of differential diagnoses here. Hepatozoon americanum can infect the bones of the mandible and the face, and can cause some periosteal new bone growth. But nothing like this. There is a similar disease in humans called infantile cortical hyperostosis that affects the bones of the face. And there was a famous movie, a wonderful movie, in the 1980s called Mask, about a young man with this infantile cortical hyperostosis. And here's a Great Dane with this particular condition, which gives it a very surprised look. Okay, here's a great picture, an older picture, but wonderful nonetheless, which also shows marked expansion and widening of the maxilla. And you can see that there are areas of reddening around that. You normally don't see that there. And this is a case of fibrous osteodystrophy. And fibrous osteodystrophy is the sort of the orthopedic manifestation of excessive levels of parathyroid hormone. Fibrous osteodystrophy in dogs is usually associated with either nutritional imbalance of calcium and phosphorus, which too much phosphorus in the ration. And so you have a dietary deficiency of calcium, and the body needs calcium to maintain a lot of very important processes, including keeping your heart beating and your muscles contracting. And the body has a fantastic store of calcium. It has the ability, through release of parathyroid hormone, to increase osteoclast activity and resorb all of that calcium out of the bone. And especially in young dogs with this condition, you will see resorption of the bone of the jaws. And what we're seeing here is hemorrhage. And you're actually seeing some congestion. Normally you don't see that because there's a lot of mineral in the bone, but when you take off all of that mineral, you will see the vascularity. Probably these teeth are a little bit loose, causing hemorrhage in there, and you have a lot of fibrous connective tissue. Increased levels of parathyroid hormone also decrease osteoblastic activity. So you're not putting down any bone. It also reduces the expression of osteoprotegerin, which is an inhibitor of osteoclast maturation and activation. So PTH comes at the bone from a number of ways to resorb calcium and to prevent it from being put back into developing bone. This condition appears to be more common in the nutritional forms, but you can certainly see it in long-term renal damage as a result of inadequate production of 1,25-dihydrovitamin D. And remember that activation of vitamin D causes the form that goes to the intestine and acts as a gatekeeper for calcium absorption over the intestine. So if you have failing kidneys, an inability to activate vitamin D, you're not going to be able to bring calcium in from your diet. Okay, fibrous osteodystrophy. This particular lesion is also seen in horses on low calcium, high phosphorus diet, where not the first bones, but certainly the most prominent visible change in the bones will occur in the bones of the face, even the facial bones and the bones of the nasal cavity. So those animals get a little bit of sturdor, and that condition is known as bran disease, because bran is sort of a concentrate, and if you give too much concentrate, that tends to be very high in phosphorus. Okay, fantastic. Now, we talked about these terms, osteopenia and osteoporosis, and I want to clarify those terms, and I oversimplify everything, but osteopenia is reduced bone mass without clinical disease, and osteoporosis is simply osteopenia with a superimposed fracture. Okay, so there are many causes of osteopenia in the dog. Calcium deficiency we've looked at already. Starvation we've seen when we looked at the growth arrest lines. Another one is physical inactivity, because bones sort of respond to pressure and electromagnetic forces that we can't see. And so if you put your bone in a cast, as I have recently done for about 8 weeks, you tend to lose significant bone mass. Or if you take weight bearing away for a prolonged period of time, like astronauts at the International Space Station, they have to come and go back through a rigorous physical therapy program for months to years after these long voyages to rebuild the bone mass in addition to the muscle mass that they lose. Another cause of osteopenia is steroids. Steroids do all sorts of things, and you commonly will see osteopenia and even osteoporosis in dogs with Cushing's disease, because steroids stimulate osteoclastic resorption of bone and diminish osteoblastic synthesis of collagen and ultimately bone. When we look at this skull, you'll probably think of a couple things. Is it physical inactivity? Probably not, because nobody's going to cast the skull. This could certainly be starvation, or it could be Cushing's disease in a dog, resulting in tremendous osteopenia, and I would suggest osteoporosis of the skull of a dog, an unusual lesion. And a great picture that's been published many times, which shows the difference between normal bone and osteopenic bone. Now, remember, osteopenia is reduced quantity of bone but normal quality, and that's a pretty common lesion in animal species. There is another one where you have reduced quantity as well as poor quality bone. That is a condition that is seen in a number of breeds of small ruminants. And you can see it in cats as well. We'll cover it in the cat lecture, and that's called osteogenesis imperfecta. Usually has to do with deficient production of collagen and or osteonectin as well. But typical osteopenia, you don't eat, you're going to get brittle bones. You don't move around, you get brittle bones. And certain drugs contribute to this particular condition. And let's talk about joints for a moment. And as I get up in years, I want to take better care of my joints. And the best way to do that is take care of your joints when you're young. But we see a lot of degenerative joint disease in older dogs. And that a lot of it goes back to the fact that articular cartilage has a death wish. And then you think about the mechanics of joints. And as you get older, you have some aches and pains, you start to limp, and you change the location and the direction of pressures on your joints. And then over time, they become arthritic, and we have bone production around, which further changes that. So the articular cartilage of the joint is used and designed to having pressure in one particular direction, whichever it is. And when pressure comes from other ways, you tend to get damage to the articular cartilage. It's a very fragile ecosystem. Remember that articular cartilage doesn't have really a blood supply. It gets all the nutrients it needs, and it gets the energy, the oxygen for energy that it needs from the joint fluid. So that's particularly fragile and poorly planned out by somebody. It also has a minimal capacity for repair. You don't get more articular cartilage, you get fibrocartilage, which fills in defects, which in itself doesn't disperse force as well as articular cartilage. And then one more thing about cartilage and the chondrocytes that live within it, they all have a death wish. When they start to degenerate, they release inflammatory mediators and enzyme that degrade the matrix and affect surrounding chondrocytes. We're looking at very early signs of degenerative joint disease in which you see fibrillation of the articular cartilage. It's not totally gone, but it is partially worn away. And then because this cannot, you're getting excess pressure in this area on the underlying bone, you get sclerosis of the subchondral or subarticular bone. Okay, it gets denser. And as it does that, that bone does not disperse forces very well. And it's sort of a vicious cycle of damage and loss of the overlying cartilage, replacement by fibrocartilage, and sclerosis of the underlying bone, which kicks off and is a significant part of degenerative joint disease. As the condition develops, as in the head of this humerus, you will now see the subchondral bone, which is much thicker. And then as the defect extends into subchondral bone, you get the beginning of fibrocartilage, which will fill the defect and do the best job it can, but it's not a good one. Now, one of the classic signs here of degenerative joint disease, and why this can't be anything else, is the formation of these osteophytes. These are rims of bone that start out in very predictable locations because they always initially start out at the point where the joint capsule joins the bone. Okay, and when you see osteophytes, you're talking about chronic osteoarthritis or degenerative joint disease, not a lot of the other diseases that we'll see in other species like osteochondrosis or reactive arthritis. The presence of osteophytes, beyond anything else, is the best indicator for the diagnosis of chronic osteoarthritis or degenerative joint disease. You'll see other things that will happen in degenerative joint disease. This is a great lesion in the acetabulum of a dog with joint problems, and this is a change in the synovial lining of that joint that's known as villus hyperplasia, usually seen with hip dysplasia. And eventually these little things might get pinched between the bones, or they will break off and they will lose their blood supply. They will become mostly cartilage, and then we call them joint mice. They can undergo osseous metaplasia as well. So usually these joint mice are a combination of cartilage and osseous metaplasia. A change that you can occasionally see in bad joints is a fibrovascular and histiocytic membrane, which progresses over the head of the affected bone, and as it does, it sort of dissolves whatever articular cartilage is left, and that's known as pannus. Don't confuse that with the pannus that you see in the eyes of German Shepherds, but it's a membrane that crosses over the bone, destroying the cartilaginous covering as it goes along. Another form of degenerative joint disease, very common in old dogs, is degenerative joint disease of the back. And it usually is the result of degeneration of the intervertebral discs. And this is a fantastic picture because it shows the relationship of disc disease to ventral spondylosis. It used to be called spondylosis deformans back in the day. But it is a bridging of these unstable vertebral bodies as a result of a disc protrusion. And I know maybe you're looking for disc protrusion up here, and type 1 disc protrusions and classic disc protrusions can cause lesions in the spinal cord, but that's the minority of what we see in animal species, or at least in dogs. In dogs, we most commonly see ventral rupture. And when you see ventral rupture and collapse of these discs, the body's going to stabilize that. And so all of these have ruptured downward instead of upward. So the animal's not, it's not paraparetic. It's not, maybe in the case of a type 1 rupture in a dachshund, where it ruptures with such violence that it causes massive damage to the blood supply. But this is what we see in older dogs, and the ventral spondylosis is the attempt to stabilize by the body these unstable joints. Vertebral osteomyelitis, great picture. We have not only a suppurative or maybe a pyogranulous osteomyelitis, but we also have a pathologic fracture and compression of the vertebra. And back in the day, this was thought to be, and it probably was, a lot of these cases were brucella canis. We don't see much brucella in the U.S. at least anymore. So you get a number of other bacteria, including Staphylococcus. I'd also think about some fungi. A number of these particular lesions are the result of migration of planktons, which may migrate through the abdomen and embed themselves in the periosteum of the vertebra, which then becomes infected with a range of bacteria, including some of the more sophisticated ones like actinomyces and nocardia. I love this because you have a combination. Look at the color of this particular vertebra as compared to this one, and this whitish color is a combination of the migration of large numbers of inflammatory cells as well as infarction of the blood supply here. Oh, this is a great picture, and you'll see this in Jubb and Kennedy. It might also be in McGavin as well. I think it was probably taken by Steve Weisbrod, who's contributed so many great orthopedic images. But this is a cross-section of a rib. And you can see that if we are mid-diaphysis, you have an area of endochondral ossification. And these particular lesions are known as cartilaginous exostoses. And this is what happens when the bone grows and a little bit of the growth plate is pinched off and separated from the rest of the growth plate. And as we said before, bones elongate from the end. So when that little bit of growth plate is left behind, it just sort of stays there. But nobody tells it that it's been left behind, and the rest of its friends in the growth plate are inches away by now. So it continues to produce primary spongiosis and remodel that, and you will get these little sort of outpouchings or bulgings of the contour of whatever bone it's on. And then when the epiphyses close, it's going to close and stop growing as well. These often do connect with the medulla of the bone that they're on, and they really don't cause much of a problem. They're often sort of a aesthetic defect. This animal has some lumps on its ribs, but it's not really going to cause any problem. There are a couple places where you don't want to have them because that extra lateral growth of the bone may cause a problem with adjacent structures. And what a great picture this was many years ago by Wendy Halpern, who I got it from. But this is cartilaginous exostosis in the vertebral body, in just a very bad place where the continued growth outward of the vertebral body caused an impingement on the spinal cord. But the vast majority of these animals with cartilaginous exostosis or multiple cartilaginous exostosis, sometimes you'll hear them referred to as osteochondromas, the vast majority doesn't cause any problem. Okay, let's finish this up with a couple of neoplasms, a couple of neoplastic-like lesions perhaps as well. And we could talk for a day about osteosarcoma. And there are so many books written about it and so many different types of osteosarcoma. I don't differentiate between them that much. Most of the time, although they've been subclassified into 5 or 6 different classifications, very little of which really impact the bad prognosis that they carry. I usually just sign them out as osteosarcoma, unless somebody's really interested in knowing what kind it is, whether it's a fibroblastic or osteoblastic or a telangiectatic, and I know there are a couple more. Many years ago, when I was working at the AFIP, and they had this wonderful special projects lab, and somebody came in with the knee of a Great Dane that had osteosarcoma in its proximal tibia. And they were able to cut in the entire knee joint and mount it on two plates of window glass. And as we were able to move this gigantic piece of glass on our microscope, you could see every different classification of osteosarcoma in that knee, and they would be within millimeters of each other in some parts. So I think a lot of what we see and diagnose is somewhat random in terms of sampling, and I'm very careful not to attribute any osteosarcoma with especially bad prognosis or especially good prognosis based on what I see within the neoplasm itself, because I think that sampling has a lot to do with what we get to look at on our small slides. Okay, so that's my soapbox on osteosarcomas. Osteosarcomas, once they're contained, as long as they're contained within the medullary cavity, you're sort of good to go. Once they get out, then all bets are off and they're going to metastasize, and they may go to lungs. About 10% have radiographic evidence of pulmonary metastasis at presentation. Okay, these tumors they have a 2-to-1 predilection for the forelimb, and most of them arise in the metaphysis in the dog. It's diaphyseal in the cat, it's metaphysis in the dog. There are a number of bones that, especially the distal radius is a great spot. Tibia, the humeral head, these are all great spots for development of this particular and problematic neoplasm. Now, one thing about the osteosarcoma, it never crosses a joint. It will stay around the area and the bone in which it does. And when you have big neoplasms that cross the joint space, you want to think about other neoplasms, not osteosarcoma. And histiocyticsarcoma is one that causes a lot of problems. It will cross the joint. As you can see here, it actually will invade the bone. So joint tumors are very different. Synovial cell sarcoma is a neoplasm which is somewhat controversial, not so much in humans, but in animals, and many of those have been re-looked at and reclassified as histiocyticsarcoma. So I would call histiocyticsarcoma number 1. You can also see some anaplastic sarcomas in this area, especially those with giant cells. So I don't generally use the term synovial cell sarcoma, and I'm certainly going to run multiple histiocyte markers for a neoplasm like this or like this. This is another histiocytic sarcoma, great picture by Famke Effner. And these are probably the majority of synovial malignancies, and they arise from the Langerhans cells, which are embedded within the synovial membrane. So IBA1 is a marker that we've used with good success here at the JPC. Histiocytic sarcomas, they can be pleomorphic. They can rarely, but I don't know how often they are erythrophagocytic in the bone. Most of the ones I've seen are in the viscera. But another thing that you may want to look for is inflammatory cells. Another population of inflammatory cells throughout the neoplasm. You usually see a fair amount of lymphocytes, some plasma cells in there. They're not a pure population, often, of macrophages. So histiocytic sarcoma, your number 1 malignancy, and one that has no problems crossing a joint space. Now, when we're talking about the joint space, there's another really wonderful gross pictures, which has been written up by Dr. Lyndon Craig down at the University of Tennessee, where she reported 39 cases of this largely benign tumor called a synovial myxoma. Great name. There's a lot of goo in these tumors. It has this bubbly appearance, most commonly seen in middle-aged dogs of large breeds, and Doberman pinschers and Labrador retrievers were mostly common. Stifles and digits were the most common sight, and these tend to exude this sort of viscous fluid on cut section. They are not malignant tumors, but they're very difficult to excise. Luckily, these animals have a long survival time, but surgery can, as you can imagine with something like this, would probably be a real problem. haven't seen this one very much, but it's a really wonderful picture from the Wednesday slide conference by Dr. Karen Dittmer. And this is a condition known as synovial chondromatosis. And we see this particular lesion rarely. We will occasionally see it in the synovial membrane or the tendons of the digits after traumatic injuries in dogs, in which you get a production of chondromatous matrix, which may even look like mature cartilage in the tendons, ligaments, or synovial membranes. As we've said before, cartilage has the ability to survive in areas of low oxygen tension. You know, that articular cartilage survives where there's very low blood supply. And cartilaginous metaplasia is often the result in many tissues and many tumors. You'll see cartilaginous metaplasia in areas where there is a very low oxygen tension. And I can't imagine there's a lot of oxygen in tendons or ligaments, and after damage it decreases even much. So we do see it. This particular is called synovial chondromatosis, but we will see chondromatous change of ligaments in older dogs, especially after trauma. On a not infrequent basis here at the JPC, where we look at a lot of older military working dogs. A couple of other fun tumors. This sort of gelatinous, silverish tumor is a chondrosarcoma, and these particular neoplasms are about 10% of primary bone tumors. They tend to arise off flat bones. This one is coming off a rib. They often, as opposed to this one, arise in the medullary cavity. So you're going to see it in the ribs and maybe the pelvis and the nasal bone, and it's most often seen in large breed dogs and for some reason sheep. So dogs and sheep, and these can be very difficult because we often don't get a good sample, and I have a lot of trouble telling mature cartilaginous metaplasia from benign tumors from malignancies. And it's one of the reasons that I always encourage, I strongly encourage my contributors, especially when they're submitting bone lesions, to submit radiographs. Clinical radiologic correlation is important, especially in neoplasms like this. And gross pictures, you just can't go wrong with. Everybody's got cell phones now, so we should be snapping gross pictures. So very difficult to tell benign from malignant neoplasms here. The malignant tumors tend to have large areas of necrosis and hemorrhage, but looking at chondrocytes, especially because of the way they're fixed, can be very frustrating in making these diagnoses. One of my favorite tumors is most often seen in the dog and man. And this is a neoplasm that often shows up at the occiput, rises from the cranial bones, and you have this repeating pattern of fibrous connective tissue and then cartilage and then bone. This particular tumor has gone by a number of names. Chondroma rodens, I think, is the oldest name. One of my favorite, for a while it was called the multilobular osteosarcoma, and now it goes by the name multilobular tumor of bone. Usually shows up on flat bones of the face. You can see it here in the cranium. Sometimes it will rise in the hard palate, and these are low-grade malignant tumors that don't generally metastasize, but they will grow inward, causing compression of the soft bits inside the cranium here. The cerebellum is pretty well squished. Usually seen in, once again, medium to large breeds, and if it metastasizes, it may go to the lung in late stages of the disease, but usually the animals show significant neurologic defects before something like that happens. chondroma rodens or multilobular tumor of bone. Some are really, really, really well differentiated. Some are sort of scattered. And I've had a couple of these on second opinion, and I send out second opinions too. I have a list of people who really are specialists in different areas, and I will send these out. And I've been surprised that people have come back and recognized multilobular tumor of bones where it never even entered my mind. Here's a fantastic image that I got from Dr. Lewis Roth so many years ago, but I've never found a better one. And this is a vertebra from a dog, and you see these punched out holes, and this is what myeloma, multiple myeloma looks like. And I think we all saw it when we were studying radiology in veterinary school, and they showed us pictures of usually vertebra and occasionally long bones that had these punched out areas. And this is what happens in bones. Now, we don't diagnose myeloma just on this, but it's a great picture. Now, interestingly enough, when you take a biopsy of this, it might not be absolutely full of plasma cells. The diagnosis, histologic diagnosis of multiple myeloma is when you get 30% plasma cells in your bone marrow, in addition to some other signs as well. Obviously, you want to have radiographic evidence. Other things that you will see besides radiographic evidence of osteolysis, because plasma cells seem to be symbiotes with osteoclasts, and their presence causes increased osteoclastic resorption. So you want to see radiographs. You also can look for protein in the urine, a light chain proteinuria, because these light chains will pass through the glomerular membrane. Blood values should show an elevated protein level, especially in the gamma globulins, and they will be monoclonal. All these plasma cells are cranking out the same type of light chain, so it will be a monoclonal gammopathy. And the other things you can see along with this are hypercalcemia from the bone resorption, and other lesions of hyperglobulinemia, including glomerulonephritis or platelet dysfunction or hyperviscosity or bone marrow depression. All of that may be accompanying entities with multiple myeloma or plasma cell myeloma. Some people call them extramedullary plasmacytomas. I always call them multiple myeloma. And we're going to finish up this particular lecture with another neoplasm that's seen in large breed dogs, and it's a great place right here. It's on the maxilla, and this is known as maxillary fibrosarcoma. It's actually a fibrosarcoma that arises usually in the periosteum of the jaws, especially the mandible. It has been overrepresented in large breed dogs, such as golden retrievers, Dobermans, and German Shepherd dogs. And it initially, when it showed up on the scene, it was called the histologically benign but behaviorally malignant fibrosarcoma. And that was a real, that was a mouthful. It was very descriptive because, very interestingly, these tumors, when you look at them, if you get a small biopsy and they don't tell you that it's sort of taken up the side of the animal's face, you're going to write it out as a fibroma because the cells are very thin, there's a lot of collagen, there's not a high mitotic rate. It's very behaviorally benign, but they can be very aggressive as well. This particular, in a retrospective of fibrosarcomas, out of 31 cases, this was 10 of them. They're also a little different in they tend to be much more susceptible to radiation treatment or other forms of chemotherapy, much more than other types of fibrosarcoma. So this is the maxillary fibrosarcoma of large breed dogs. Well, that covers this particular system. Realize once again, it's selected gross pathology. There are a lot of other diseases of bones and muscle that either I don't have pictures of or maybe I just forgot them. I hope it's the former and not the latter. But we are going to come back in our next lecture on the dog and talk about diseases of the nervous system. So I hope you come back for that. I hope you come back for other lectures in this particular series. And I do have on the Joint Pathology Center's video library or the Foundation's web YouTube channel an entire series on musculoskeletal disease in all of the animal species. So if this particular lecture piques your interest, maybe you'll go back and look at some of those as well. As always, I wish you good health and a great day.